Are these 5 factors increasing your risk of pancreatic cancer? Pancreatic cancer is one of the deadliest types, taking over 450,000 lives annually. It ranks among the 12 most common cancers worldwide and has been rising by 1% per year since the 1990s. Alarmingly, only 5% of those diagnosed survive beyond 5 years. In today's video, we'll discuss 5 key reasons that can lead to pancreatic cancer and share important information about this life-threatening disease. Don't forget to subscribe and hit the notification bell to stay informed with our latest videos. How does pancreatic cancer develop? Pancreatic cancer starts when cells in the pancreas mutate. The pancreas plays a crucial role in digestion, producing enzymes and regulating blood sugar. Genetics, diet, health, and lifestyle can trigger mutations that turn normal cells into cancerous ones, forming tumors. The most common type is pancreatic adenocarcinoma, occurring in the ducts that release digestive enzymes. How long can you have pancreatic cancer without knowing? Pancreatic cancer is hard to detect early due to the lack of obvious symptoms. People may live with the disease for 10 to 20 years without realizing it. Researchers at the Autonomous University of Nuevo Leon in Mexico found that early detection occurs in only 10 to 20% of cases. Even when caught early, survival beyond 5 years remains low, at around 5%. This is because, although it grows slowly, pancreatic cancer spreads aggressively. If your family has a history of pancreatic cancer, your risk may be higher, though many people diagnosed have no family history. If your parents, siblings, or children had the disease, your chances increase. Other DNA factors, like previous cancer or gene mutations, can also raise the risk. Still, having family cases doesn't mean you'll get the disease, but regular checkups are important for early detection. Does coffee cause pancreatic cancer? Since the 1980s, researchers have studied whether coffee increases the risk of pancreatic cancer. Studies have shown that coffee does not appear to raise the risk. In fact, it might even help prevent it. Specialists in China reviewed various studies and concluded that coffee's cell-protecting antioxidants may help repair DNA and reduce inflammation. However, moderation is key, and watch out for added sugars, which aren't part of these studies. 5 modifiable risk factors for pancreatic cancer. These are factors you can change to reduce your risk of pancreatic cancer. Tobacco use. Smoking cigarettes, vaping, and using other tobacco products introduce carcinogens into the body. It's estimated that 25% of pancreatic cancer cases are linked to smoking, making it a major preventable risk. Excess weight. Being overweight or obese puts extra strain on the pancreas, leading to inflammation and a higher risk of cancer. Extra abdominal fat forces pancreatic cells to work harder, potentially triggering the disease. Diabetes. Those with diabetes, particularly type 2, are at increased risk due to the pancreas's overworked insulin production. Fortunately, diabetes is a manageable condition, and taking control can reduce cancer risk. Chronic pancreatitis. Prolonged inflammation of the pancreas is associated with pancreatic cancer. Managing pancreatitis by avoiding alcohol, quitting smoking, and following medical advice can reduce the risk. Chemical exposure. Regular exposure to industrial chemicals can raise the risk of pancreatic cancer. Preventive steps include wearing masks to avoid inhaling harmful substances or considering changes to work environments. 4 non-modifiable risk factors for pancreatic cancer. Age. As you get older, your risk of pancreatic cancer increases, especially after age 45. with the average diagnosis occurring at around 70. Gender. Men are more likely to develop pancreatic cancer, though the reasons for this are not fully understood. Family history. If you have close relatives with pancreatic cancer, your risk is higher. Genetic conditions like Lynch syndrome or familial pancreatitis can increase this risk. Genetic mutations. People with genetic mutations that lead to chronic pancreatitis have an elevated risk of pancreatic cancer. Factors that may or may not be linked to pancreatic cancer. Diet. A diet rich in processed meats, sugars, and refined carbs may increase the risk of pancreatic cancer. Eating balanced, nutrient-dense foods can help. Sedentary lifestyle. A lack of exercise contributes to pancreatic cancer risk, as it doesn't allow for proper glucose management and encourages fat accumulation. Coffee. Some studies suggest coffee may increase pancreatic cancer risk, while others indicate its chemopreventive properties. The risk may be related to added sugars rather than the coffee itself. Alcohol. Heavy alcohol consumption can cause inflammation in the pancreas, raising the cancer risk. Infections. Certain digestive tract infections may contribute to pancreatic cancer risk. 7 signs of pancreatic cancer. Jaundice. A yellowing of the skin and eyes could signal a tumor in the pancreas blocking the bile ducts. Itchy skin. Buildup of bilirubin, a yellow digestive substance, can cause itching. Changes in stool and urine. Lighter, greasier stools and darker urine may indicate pancreatic cancer due to bile obstruction. Digestive issues. Pancreatic cancer can affect digestion, causing bloating, loss of appetite, or rapid weight loss. Abdominal or back pain. Tumors can cause sharp, sudden pain in the abdomen or back. Blood clots. Pancreatic cancer increases the risk of clots, such as deep vein thrombosis or pulmonary embolism. Sudden onset of diabetes. Tumors can interfere with insulin production, leading to sudden diabetes. While complete prevention is impossible due to factors like age or genetics, addressing modifiable risk factors can help lower the chances of developing pancreatic cancer. Early detection is vital, and regular checkups are key. If you experience any of these symptoms or have a family history of pancreatic cancer, consult a doctor for early diagnosis. If you found this information useful, don't forget to like, share, and subscribe for more content on staying healthy.